Hi there, this is Sally, and I'm going to make a video. Let me tell you something. I obviously cannot prescribe anything. You have to get, or anything I would say you'd want to talk to your doctor about if you were interested. But let me just tell you that I had chronic cystitis, right? So I went to the doctor and I had a cystoscopy. So you're thinking that's when they take the scope, they go into your urethra and they look at your bladder. And so he diagnosed me with chronic cystitis. I already knew I had that before I had the test. I just wanted to make sure I didn't have cancer, right? So it was important to have the test. Now, let me just tell you that prior to going to him, I had spent $2,000 on urine tests. One time, I gave my doctor a urine specimen that had blood and white little strings in it. It came back negative. Negative. No urinary tract infection. So then I sent my urine to a parasite testing center. It's called Parasitology Lab in Scottsdale, Arizona. I think it was like $150. They found a parasite in my urine. Now I'm going to get back to that because that's a big topic. I'm just going to veer just for a little bit. Because I was so miserable, I had to do something to help me feel better. Okay, I took a product called Urinary Cleanse, and it's by a company called Life Seasons. And that cleared my urine. I didn't have any more blood in there. I didn't have any more white stringy things in there. And I had better bladder control and less pain. So that was a good product for me. Now, I took that because I didn't know what to do. Then when I found out that I had the parasite in my bladder, the lab said, this parasite might just be in there, may just be passing through, may never cause you any problems. Say what? Okay. It is not okay with me that a parasite is passing through my bladder. And I'm not about to believe that it's harmless. So I took the medication for the parasite. I no longer have to take that herbal blend. The chronic cystitis went away. Now, I do still periodically take this, the albendazole, that's the name of the medication. I do take it periodically because I have tested, I've retested, and still had the nematode in my urine. So I don't know where I'm getting this thing from. I don't know if it's from the simple fact that parasites produce 2,000 eggs a day and it just takes a really long time to eradicate these things, or if it is because I'm still maybe it's contaminated food, contaminated God only knows what. I mean, parasites live in the dirt, food grows in the dirt, stands to reason you can catch a parasite from just regular food. So I am much better. I don't cough when I sneeze. So here's the thing. They said that this parasite could be passing through and probably would do me no harm, that I probably wasn't the proper host for it to actually develop in. But yet it was doing me harm. I had chronic cystitis for years, decades. Because I had a child, I thought, oh, this is what happens after you have a child. No, it's not. That part is just a coincidence. So I encourage you, if you are having issues, but can I also back up one more time? Whenever I sent my urine, remember the cup full of bloody urine with the white little squigglies? They didn't test it for a parasite. They did a culture and sensitivity. I guess they're just looking for bacteria. Maybe you get lucky and they look for a fungus, but are they not looking for parasites? Especially if they see them? I don't think that they are. I don't think it's on their radar. I don't think they know to do it. I don't think that they're taught to do it. We are so ingrained in this belief that we are a first world country and we do not have parasites. And that is just not true. And I don't think I'm the only one that's not true for. I actually watched a video of someone who put her parasite results on her YouTube video, and she was told the same thing I was told. This parasite could just be passing through. You're probably not the proper host. It's not going to develop inside of you. Well, I'm not taking any chances. I'm going to tell you that. Okay. But the reason I'm calling it a nematode, and the reason that they called it a nematode, is that, I'm sorry, I had a little something on me, that is the familial category that this parasite would go into. And then there's, and under that category, there's all different kinds of parasites. And they respond to different treatments. But it was so small and had not developed that they couldn't tell me the specific parasite it was, but at least because I knew what family it was in, we had an idea of which medication I needed to take. Now, the problem is not knowing the exact parasite. You don't know the exact length of time to take the medication, because some of them, you take the medication 3 days, do it again in a week, and you're done. Some of them, you got to take it for a lot longer. So that was unfortunate, but I just wanted to put this information out there because a lot of people are suffering needlessly because we don't know. We're told you don't have these, don't worry about it. It's worth testing. And if you're having weird symptoms and you get a negative test result, maybe that's not the lab for you, or maybe you just have to do it again and again. I think it's certainly worth investigating. Okay, nothing's more important than your health. Take care. Good luck on your health journey.